There's some big health news today because some of America's largest airports, they are now screening passengers from central China after there was this respiratory virus outbreak. So far, this virus can cause pneumonia, which killed at least 3 people. It's sickened more than 200 others. So Dr. Daria is breaking this all down from us, how to keep from getting this flu. Dr. Daria Long, so good to have you. Thank you.
Lynn.
So it's called the Corona Virus. It's already killed 2, sickened 200, hasn't come to the U.S., but the CDC is sending people to airports?
Right, so the coronavirus is the name of the family. That family also includes SARS and MERS. So this is a new strain we had never seen in human beings before. We don't know how easily it's spread from person to person, but they're being really proactive just because of those connections.
And the screening, can they screen for it? I mean, how would they do that? All I read was like they're taking people's temperature.
Yes, they are. They're taking people's temperatures, asking about symptoms, because those are some of the, cough and shortness of breath and fever, some of the earliest signs.
So next up, a big story because it's a new study that's come out. It's revealing for the first time that women's blood vessels age faster than men. So this has some serious effects, of course, on your blood pressure, also on your heart health. So Daria, what do we need to know about this when it comes to what that could lead to and also why?
Yeah, so it's really interesting. For a long time, we thought, well, women are protected from heart disease because of estrogen, and that keeps them safer, and it does, but we're finding out that high blood pressure in women is even more harmful to their hearts and to their blood vessels and raises a woman's risk of heart attack even more than high blood pressure affects a man.
So should older women be doing anything different than they're doing now because of that?
Yes, actually, I'm glad you asked that, because women in general are found to be less well treated for high blood pressure, and we don't always know the doses for women because they're often have been tested in men. So what I tell my patients, especially if you're female, make sure you're getting that blood pressure checked. You may have to titrate the doses and keep taking it. I have so many of my patients in the ER, they say, well, I used to have high blood pressure, so I stopped taking my medications. Don't. These medications don't cure high blood pressure. The only thing that cures it is things like weight loss, controlling your stress, exercising, eating better.
Such great advice. Okay, let's move to our third topic, because if you have one of those Fitbits, maybe you got it for Christmas, right? It tells you how many steps you've taken. It can be great to keep healthy, but also it can track more than your fitness. There was this new study that found it could help predict flu outbreaks as they happen. This was done by researchers who used data from the Fitbit. So also a big warning sign, if you're using these free apps, it is being sold to companies to analyze, and that can be for a good reason. I mean, obviously it helps us predict the flu. First, how does this actually work?
Yeah, so this is actually a really good thing. When you start to get sick, one of the early signs we look for it in the ER is that your heart rate starts to rise. So in this study, they looked at people's heart rate, and they found that there was association between that and more cases of the flu.
Don't you think that this could be used for so many other things, not just the flu? I mean, it could detect a good bit of different diseases.
And it's great for public health officials to be able to use this data. You just have to make sure it's anonymous. Full disclosure, I'm wearing my Fitbit right now, so I love tracking my steps, but you have to be careful what apps you're using, where you're sharing your data, because people can potentially get access to your data.
And they're taking out people's names. I mean, that way you don't actually say,
take out your name and your location.
Lynn Smith weighs X amount. Lynn Smith weighs 98 pounds. No,
exactly.
They don't have that kind of information in there.
No, they usually only have it to the level of your zip code, that people in this zip code are having this high temperature or having this high heart rate. It can be helpful for schools, for businesses to know something's trending up before you see the 30 people in a class who are all sick.
It's really interesting. Dr. Daria Long, always so good to have you. And head over to her website. She's got this really cool, crazy, busy test score. You can take it to find out, 1, if you're crazy busy, and 2, what you can do about it, more importantly. That's Dr. Daria Long, drdaria.com. Thank you so much. Good to have you.